not him. But he unfortunately got sick and was unable to come today. So I get the pleasure of working with this amazing group of panelists today and asking questions. And so just in general, a couple things. So please check in and just pass it around so other people get a chance to check in. Did you all see the Cope Scholars booth outside? They're going to be there after as well, so if you have any questions or want to talk with them, you can. And then other than that, we're going to go through for an hour, and at the end, you all will have an opportunity to ask questions. So please think about if there's anything you would like to ask them. I'm really excited. Our topic tonight is maternal health. And so I'm going to get started by letting them all introduce themselves. So if you don't mind, can you please say your name, describe your role in your organization, what you do, and how it serves our community? And whoever wants to start, please start.
Hi, my name is Delaney Gibbs. I'm a medical social worker at Community Memorial Hospital. I work in labor and delivery, postpartum, and the NICU. So my role, I meet with every single NICU parent regarding, postpartum depression, kind of what goes on in the NICU. And I meet with them minimum once a week to check in on their mental health, making sure they're taking care of themselves physically, because it's really easy to get lost in that environment. And then in postpartum, I meet with moms based on orders. So anybody with a mental health history, anybody with financial struggles, anybody that maybe had a traumatic delivery, or just a history of trauma, housing problems, things like that.
I can go next. Good evening. I am Erin Milner, and I am currently a global nutrition independent consultant. Until about a month ago, I was working as a senior nutrition advisor with the Public Health Institute, as well as the United States Agency for International Development, or USAID, as part of the federal government, as a senior nutrition advisor. So in my role, I work a lot with nonprofit organizations, governments, primarily in low-income countries, as well as large United Nations entities like UNICEF, the United Nations Children's Fund, and WHO, the World Health Organization. And in my role, I work closely with these other actors to design, strengthen, and implement programs and policies in some of these low-resource settings. I particularly work primarily in Sub-Saharan Africa. And this is serving the larger global community, but there are a lot of parallels here in California and our own community, given that there's so many diverse cultures and populations. A lot of the nonprofit organizations that I work with are also based in California as well. So it's nice to be here and hope everyone's nice.
Hi, my name is Manisha. I am a maternal child adolescent health epidemiologist with Ventura County Public Health. My role consists of doing birth and death analysis, so a lot of population health. I do reporting analysis for our different programmatic activities, so things such as home visiting, nurse, family partnership, things like that. I am also one of the leads for a community health needs assessment that consists of serving the community in different ways, so focus groups, listening sessions, and synthesizing that data to find out what the needs are of the community. And then from there, we work with various stakeholders and hospitals throughout the county in order to address those issues.
My name is Tanya McCracken, and I am a community midwife. And what that means is that I'm an independent healthcare practitioner, so I am licensed by the medical board the way a doctor is, but I specialize in low risk, normal birth and pregnancy. So I provide comprehensive midwifery care, so that's prenatal care, birth, postpartum care. I can also do preconception, conception, wellness exams. I am a small business owner, so I do everything. As a midwife, so I attend community birth, and what community birth, the definition of that is any birth that's outside of the hospital, so it could be at a birth center, and I primarily practice in people's homes. And like when you birth in the hospital, you have a nurse and a doctor and a postpartum nurse, and somebody from the cafeteria brings you food, and the janitor cleans up when you leave, and I do all of those jobs.
Thank you so much. We're so excited to have you all here and what an amazing array of careers. Before I ask the next question, I noticed some people standing. If you all want to fill in, there's some seats here in the front. You don't have to stand this whole time. I know the front row can be scary, but I promise we're a very nice group. Feel free to come on down. But she just said, oh. All right. So for the first question, and please feel free, whoever would like to go first, to answer it. So maternal health is influenced by a range of factors. From your perspective, what are the biggest challenges facing maternal health today?
I can start. So I think, there are a lot of different aspects of maternal health and maybe some different domains per se, and of course all of them are interconnected. But I think a major challenge related to maternal health is mental health. I think especially for first-time moms, it can be very overwhelming in terms of what's happening to your body, what to expect. I know as a mother myself of 2 young children, there are limited resources available also to support mental health. And it's an emotional time, your body is going through a lot, and often it's challenging to address what's happening in your body physically. And related to mental health, I think in terms of physical health, nutrition is also a major challenge, especially in our society where the food industry has such a large influence over what food is available, what food we as well as women consume. There are increasing rates of overweight and obesity, and pregnant women who are obese are at increased risk for a lot of adverse outcomes. And there are also sort of food deserts where there is limited access to foods, especially healthy and nutritious foods, or all of us can probably think about when we go to the grocery store or even farmers markets, anywhere. Healthy and nutritious foods are often more expensive than unhealthy foods, which is particularly important during pregnancy and when a child is young.
I can add on to that. I would say also barriers to healthcare, which includes like lack of comprehensive care, which includes the prenatal, perinatal, and postpartum care, I think, and also misinformation and not knowing who to trust. You may have maybe differing opinions, or you see something online and it maybe contradicts what your doctor said. So a lot of people maybe don't know what to do in those situations. So I think that's something as well.
Something that really can be about is like there's any lack of resources. One thing we've found, one of my biggest roles is doing postpartum education with moms who have just given birth. And like you were saying, a lot of things that we get to expect. And what we have found is that there are specifically limited resources in Ventura County. So there's not a single NICU support group in Ventura County. There's several hospitals and several NICUs. So that's something that, we've run into a little bit. There's support groups, there's online groups, there's things like that, but when you're addressing mental health and encouraging these moms to take care of their mental health, and then there is a lack of resources to refer them to, that is one challenge we definitely face.
It's like there just needs to be more connection, right? So there needs to be connection among families that are having babies. And I feel like a big part of the problem is the nuclear family. Everybody is isolated and living independently and feels like you have to do it all yourself. And really, this is a time when we need to come together and support each other. And I feel like the resources piece kind of ties into like we as providers need connection as well. We need those referral lists and to be able to communicate with each other about how people are doing.
That was the perfect lead into this question, so this is again for anyone who'd like to answer. How can different healthcare professionals, such as your unique areas, collaborate more effectively to support maternal health?
One thing that I think would help in the social work realm is communication during prenatal care to the hospital staff. So I know in my role, again, I do a lot with the mental health aspect. This could also include addiction, this could include history of trauma, all of those kinds of things. And I know for us social workers, if we find out about these things that are going on in a mom's life before she comes into the hospital, then we can be much better prepared for when she is there, for what resources we can provide for her. So I think that's one thing that we've started to work on improving, but obviously we can still use more.
Something that we do at the county is we have a perinatal substance use task force where our nurses meet with various hospitals to maybe talk about best practices on what to do when a baby is born, addicted to drugs, how to treat the mom, and kind of bridging the gap between like public health and also the providers that see the mom and the baby in more of a clinical setting. I think maybe having more groups like that where you coordinate people from different sectors to kind of, achieve one common goal of having a healthy baby and a healthy mom.
I was thinking about this question. It's interesting because we're all like pretty different up here, and so if you take the question like, I could collaborate with other midwives, which I actually try to do. I've started the Ojai Birth Collective, where we're trying to get everybody related, in the community. But it would be really interesting for like us to collaborate, right? And so like, what I'm envisioning is like the Ventura County Birth Symposium, right? Because how can we improve our collaboration if we're not even collaborating? We like need to like start it, right? Something.
I think maybe building off of that from a nutrition perspective, I think nutrition is sometimes seen as, or treated as separate from the health system, and even when health professionals are receiving training, including nurses, doctors, I'd be interested to hear from you about midwife training. Nutrition is not part of that, yet it is so important, especially during pregnancy and post-birth, and I think that is also something that we could use more collaboration around, whether it be having more nutrition resources available during doctor's visits or midwife visits, or, it's not probably realistic for all healthcare professionals to have expertise in nutrition, but I think somehow making those connections and making sure that the mom is, aware of different nutritional needs during this critical period of life is important. But yeah, I don't know if you have any experience in managing nutrition in one of your 1,000 roles.
Yeah, I would say that nutrition is a really important part of midwifery care and something that kind of sets us apart than I feel like the doctors do. I feel like that's one of the huge benefits of midwifery care. Somebody had mentioned continuity of care, so knowing somebody throughout your pregnancy, knowing they're going to be there at your birth, knowing they're going to take care of you postpartum, I think that's such a huge benefit for families. And I think somebody else had mentioned earlier too, like just how everything can be so disjointed, right? So you go see your nutritionist for this, you see your OB for this, and you see your, and people can get different messages, and it's hard. So like, again, the collaboration, the communication among providers would make it easier for families, I feel like, instead of like, it's so hard to go to so many different places for each little thing,
Any final comments? Tanya, I think like kind of building on that a little bit more, what do you think some misconceptions about midwifery are that you wish more people understood? It's a long list.
So a lot of people don't even know that midwives exist, that we are out there attending births in people's homes. So even that is the first one. A lot of people kind of confuse midwives with doulas. So doulas provide emotional and physical support, and I am a medical practitioner, so I can take blood pressure, I can listen to your baby, I carry anti-hemorrhagic drugs, I can give you an IV, I can suture you, like all of the normal complications that can come up with labor and delivery you can deal with. So I feel like that's just an unknown, like A, that there are midwives, B, that we are skilled professionals, we are independent healthcare professionals, I'm not supervised by anybody. Yeah, those are the main.
That's wonderful. Awesome. Delaney, put you on the spot now. What strategies have been effective in connecting at-risk pregnant individuals with the resources they need?
So this kind of brings that's what I was saying with connecting with people in prenatal care. So, my role is typically in postpartum, right? Like, right after they've delivered, whether that's day of, next day, day after that, whatever that may be. But when we have had the opportunity to connect with moms when they are still pregnant, our strategy, honestly, is listening to them. And it's as simple as that. What is your goal? What is your expectations for your postpartum experience? What are you struggling with in your postpartum experience? What are you nervous about? And then this way, when they do show up to the hospital and they are in labor or in postpartum, then we are better prepared with the list of resources that they need. We've already sent referrals for what they need, and things like that. And it could be something as simple as I had a mom who didn't have a ride home from the hospital, and I happened to meet her when she was like 25 weeks pregnant. I had a ride set up for her before she flew. And so it was as simple as that. And this way she didn't have to stress about that anymore. It was one thing off the list. So yeah, I don't know. I think just being able to listen to moms and listen to their goals so that we can accomplish their goals and just assist them in that is the biggest thing.
Thank you. And then back to kind of everyone. Maternal mortality remains a serious issue in the U.S. and globally. What are some critical steps that healthcare leaders should take to address this crisis, or even maybe in your role specifically?
I think we need more providers, and in my opinion, it needs to be more midwives, right? So between 60 and 90% of birthing people are considered low risk, right? Depends on what you look at. But even if that was considered 60% of people giving birth are not going to have any complications. And that is our specialty as midwives. And when I started midwifery 20 years ago, we were at 1%. 1% of babies were born outside the hospital in a community setting. And now it's 2%, so it's growing. That's great. But still, there's a lot of people that don't know that it's an option. And even if they did know that there's not enough midwives, so I'm not saying that everybody needs to birth at home, because that's not the case. You need to birth where you feel comfortable. But we need to have more midwives in the hospital. Like, I have encountered so many people that want hospital birth, want midwifery care, want this personalized continuity of care, want this connection, this customized care to like what you especially need. And so yeah, I just feel like outcomes would be so much better when like the individual person and family is seen and what they're wanting, because the healthcare system right now is just so big and there's not enough providers. So each person is getting the cookie cutter same thing because that's all that can be done. And if we had more providers, then people could be seen and their desires honored.
I think I'll also add that in terms of maternal mortality, you mentioned this country and also globally. I think first, as a leader, I think was mentioned in your question, to address maternal mortality, we would need to understand what the causes of maternal mortality are and what the causes are in different populations. In this country and globally, there are different causes in different populations related to culture, maybe how a woman is giving birth, but also related to geography, where a woman might live, and then directing resources to programs and policies that can then improve maternal mortality rates or decrease risk. Even when I've worked in sub-Saharan Africa in rural areas, women don't even have access to healthcare facilities, to trained professionals, or even to sanitary equipment or sanitary environments. And my understanding is that that is also similar in some rural areas of the United States as well. And so in those areas, causes of maternal mortality may be higher than in than other areas, but also the maternal mortality may be higher, but the causes also may be different than in other populations. So I think understanding what the specific causes are and then specifically addressing those or directing resources to address those is important.
Well, I can just add on, I would say also just continuing to give the providers education, whether it's like trauma-informed care, implicit bias, and also kind of sharing the decision-making with the moms so they have some autonomy in terms of, what's happening with their body and what's happening, throughout the process, especially if, if she had complication in her last pregnancy, and also incorporating mental health care as part of the prenatal care. checking in on that throughout the whole process. I think,
Yeah, we have maternity care deserts here in California, right? Hospitals are closing, maternity centers are closing, access is decreased, so that's why we need more providers. Not even, but I would say that it's probably less expensive and quicker to get a midwife in a rural area than it would be to get a doctor, but we just need more providers, so that families are seen, right, and heard.
Absolutely, thank you so much. Misha, from a public health perspective, what does the data tell us about the most critical maternal health disparities today?
well, this kind of goes back to the mental health aspect. Just something from CDPH data that we have, the latest available data that's on the CDPH MCH dashboard shows that Ventura County, our prenatal and postpartum depressive rate symptoms are higher than the state average. And it's kind of been that way for a few years. And so I think that's something that needs to be worked on, just giving moms those resources, giving them that support, talking to them, seeing what they need. I think, the data is telling us that, moms need that support and they need that help. And so we mentioned, lack of resources. So that's something that the data is telling us, that we need more mental health providers that are open to receiving patients. Because sometimes there are providers, but they're not accepting the patients. So,
Thank you. Erin, what would you say some culturally appropriate strategies for promoting better nutrition among diverse populations would be?
Yeah, I think first it's important to be aware of the cultures and the cultural approaches that we're working with in terms of nutrition. There are often taboos or different traditions or practices that different cultures undertake. I'm sure all of us can think of different traditions we practice, or even where, when, how, what we eat, and what influences that. I'd love to hear some examples later as well, but even in terms of pregnant women, in cultures there are a lot of different approaches or taboos, and again, I would love to hear some examples, but from my work, I know a lot of cultures actually don't eat meat or dairy, and these foods are highly nutritious, and this is important especially during pregnancy when nutrition needs are increased. However, when promoting nutrition, in working with a community or an individual that does not eat meat or dairy, we would not want to promote that. Another example is when I was working in Ghana, it was believed that if pregnant women consumed eggs, then their child would be very large and childbirth would be very difficult and painful and even dangerous. So pregnant women in Ghana, even though eggs are a nutritious food, did not consume eggs. And again, it's an example of where some of our nutrition programs would not, decide to promote eggs or the consumption of eggs. And interestingly, in Kenya, similarly, there is a belief that consuming eggs during pregnancy will lead to a child becoming a thief. And so again, eggs were very taboo in that culture. And in other programs I've worked with or countries, we promote eggs because they're easy to hard boil or to make it there. They have a lot of nutrients, but in these settings, it was really taboo for pregnant women to consume eggs. So just being aware of what some of the cultural nuances are is very important when thinking about what types of nutrition advice or counseling to provide.
You all brought up kind of like gaps in care access challenges, and technology and telemedicine are rapidly evolving in healthcare. How do you see digital tools being used to improve maternal health outcomes?
I would say, for example, the access to care piece, if someone can't take off, 2 hours out of their day because they have to go to work, they have, technology has advanced, so things such as glucose, heart rate, blood pressure can be monitored remotely. And, with technology, you can sync it to an app or your phone, and your doctor can essentially monitor you remotely and maybe kind of keep track and maybe intervene before things get too bad, I think. So that's something that I think kind of helps with the access to care and also with the technological advancement as well.
Going off of that, I think that being able to, again, my thing which can lead to difficulties, right? Because if your baby has a heartbeat and you just can't find it because you're not a medical professional, that can cause stress. However, it could also be stress. You can have, lack of fetal movement and you're able to find that heartbeat, it can kind of calm your mind. Going off of that, blood pressure cuffs at home, things like that. Something that we've seen in postpartum that's already starting to improve is the portable breast pumps. So moms are able to go back to work, which sometimes helps with the mental health, but they also know that they're able to provide for their baby and they can work while they're found that helps moms a lot. So.
I think I'll add in terms of nutrition now, there are also several apps that provide nutrition and counseling that can be tailored to a woman's food preferences, but also to what stage of pregnancy they're at, or even postpartum. There are apps to provide support with lactation, links to lactation consultants. There are also ways that providers or nutrition specialists or even AI is increasingly being used to provide information related to prenatal supplements, which are very important often during pregnancy. Even when I've worked in low resource settings with nonprofits or in countries in sub-Saharan Africa, even in communities that don't have electricity, it is very common for women or families to still have a smartphone. And so a lot of work, whether it be through nonprofit organizations or otherwise, have been using apps or text messaging to provide tailored nutrition counseling.
I don't know if the social media qualifies as technology, but I think it's a huge part. And so it comes in the form of education, right? So like, it seems like a theme that keeps coming up is education. Like families need well, I see it two-part. One is there's continuing education is online all the time these days, right? That's how we as providers stay on top of things and provide excellent care. But then also for families. So like if you don't know about home birth, you could go home tonight and look at Instagram and watch 100 movies on home birth and see what that looks like, right? You could decide you want to become a midwife and you can go home and do research. What does it take to become a midwife or any one of these professions, right? Like, so the access to information and in a very, like in a visual way. It's not just like, you gotta go to the library and you gotta read the book or you gotta find somebody to ask. Like the access to information is there. And I think that's huge in terms of like learning about so many different things. And then also electronic health records allow families to be able to communicate with their providers, allow access to their records if they're going, if they're changing providers or for some reason. So just make, it's flow of info is easier.
Did you mention social media? From your perspective, does anyone have anything else to add about like the role of social media, either in a positive or times when maybe it's created confusion or even like more, miseducation for any patients, or the tools of positive when it comes to social media?
I think just comparison, no two births are the same, no two deliveries are, no two deliveries, no two prenatal experiences, postpartum experiences, NICU experiences, no two are going to be the same. I've had moms talk to me and they'll be like, well, I saw this on Facebook in this support group, and I'm like, yeah, Facebook support groups are great, but it's not going to be the same experience as your own. It's no two experiences are the same.
I think maybe related to that and what you had mentioned earlier about misinformation, I think especially related to nutrition, there are a lot of superfoods, or even with the food industry having sort of false advertising on a lot of, maybe everyone can go home and look at their packaged foods, or next time you go to the store, maybe you'll see mention of advertisements about things being healthy or nutritious in some way, or added vitamin D. But I think especially with social media and increased access to technology, that can even be enhanced in a negative way, talking about how foods might be superfoods or healthy in some ways, but that may not in fact be the case, or it may be unclear, why some nutrients are needed rather than others, or why consuming two nutrients together at the same time could actually inhibit the absorption of one of those nutrients.
And also sometimes increased risk for specific foods. For example, if your doctor, provider, whoever you're working with is telling you, these foods may not be the safest to eat while you're pregnant, but then someone on social media is like, well, I ate these my entire pregnancy and my baby's just fine. So things like that, just from a different perspective, instead of going off of maybe not knowing like trust? Like, do I trust this woman who is in the same position as me, who just gave birth, and she has a healthy baby, and her doctor said to eat this, and it's gonna be fine? Or she said that, you know, when she ate this, it was fine, but my doctor's telling me not to, so it just can get a little tricky.
You gotta use it responsibly.
Yeah.
Right? It's
Yeah.
like, we're in class together, right?
Yeah.
We're learning how to write a paper together, we're learning about plagiarism, we're learning about what is a good source of information and what is not, right? So,
Awesome. Well, thank you for letting me fit it in. The social media got brought up, so I couldn't leave that one alone. Tanya, what are some of the biggest barriers to accessing midwifery service, and how can they be addressed? So even maybe someone wants to use a midwife, what are some of the barriers there?
Cost. Cost is, I would say, is a huge one. Medi-Cal reimbursement is very minimal. There's not very many providers that take Medi-Cal, and most families here in California are on that health insurance plan. So I would say that's the biggest barrier, is just not being able to afford it. And then I guess not knowing that it's even an option. And also, you know, talking about maternity care deserts again, like, you might want to have a midwife and there might not be somebody in your area or somebody that's available.
And Delaney, I know we've talked a little bit about this, but is there anything that you'd like to expand upon in terms of what the most pressing social challenges are that pregnant individuals face, and how social work can work to address that?
I think a big one is lack of education, like we've touched on several times. And then another big one is just financial struggles. You know, when it comes to whether that's health insurance, getting health insurance for your baby, things like that. One thing that I learned in this role was that, you know, you can be on your parents' health insurance until you're 26, but your child can't be added to your parents' health insurance. So that's something that we have to provide the education on to those moms. Car seats are expensive, breast pumps are expensive, bassinets are expensive. So I would say that informing moms, one way that we help is by informing moms that there are community resources. You could rent breast pumps from insurance, from WIC, from all those different things. You can get used car seats that are still safe from different community resources, which is something that's super important. So yeah, I would say that those are some of the biggest barriers for sure. And then other barriers that, you know, are specific to certain individuals are the drug epidemic that goes on. Using drugs when you're pregnant is incredibly dangerous for you and your baby. And going back to the social media aspect, there are marijuana doulas, there are things like that that give you misinformation saying that these things are safe and people have different perspectives. But yeah, so part of my role is just connecting moms to those resources, and that kind of brings me back to working with the prenatal care. Is if I knew a mom was battling addiction or didn't have a car seat or things like that, I could have that set up for her before she even got to the hospital. But yeah, so I would say that those are some big things, and then my biggest role is connecting people with resources. I get car seats for moms, I get them delivered to the hospital so they have a car seat to bring the baby home in. CPS is scary for a lot of people, but CPS has great family preservation programs for moms that are struggling with addiction and just don't know what steps to take to get sober. So yeah, that's kind of how we can help with that, is just connecting them to those community resources that most people don't even know exist.
Monisha, how can epidemiological research help shape policy and healthcare intervention for maternal health?
I think looking at risk factors that lead to adverse outcomes for moms. One thing that I've recently started being more interested in is cardiovascular health. So when you're pregnant, your blood has to pump so much more to, you know, give the blood to you and your baby, and sometimes that can lead to issues such as like high blood pressure, preeclampsia, and it can worsen those conditions or maybe just start those conditions if you didn't have them before. And it can also affect future pregnancies. So doing more research on that. In a dream world, preeclampsia is going to be completely rare. You know, maybe doing more research to see what we can do to kind of lower the risk factors for preeclampsia in women.
And then I want to bring it a little bit more to the kind of advice for all of our wonderful students here. So what role does community engagement play in ensuring better maternal health outcomes, and how can students or aspiring health science professionals get involved?
Be interested. The learning, you know, be willing to go into this field where a lot of things are undetermined and a lot of things are scary. And like I said, it's different for every single case. So I think just being interested and open to learning is the first step for sure.
Going back to what you were saying about the cultural differences, maybe having those leaders kind of, develop relationships with maybe leaders in healthcare. That way, those communities can have more trust, with different providers. That way, if there are any like misconceptions or they're afraid to go to the doctor or anything like that, they have kind of like that trusted leader that they may know, or someone from their church or their advocacy group or anything like that, that can kind of help bridge that, that divide between seeking care and maybe not wanting to go to the doctor because, they eat different foods or they have a different diet or things like that.
Yeah, I think building off of that community engagement is also important from the nutrition aspect as it relates to maternal health. I think peer groups were brought up, and even having groups with mothers at a similar stage in pregnancy or a similar point at which their child is developing is important for nutrition, maybe to debunk some of the social media taboos that we've been talking about, but also nutrition educators can join some of these groups to share information. There are some standardized even nutrition counseling cards that get adapted for different cultures that UNICEF has developed, for instance, and those are often used for community groups, not just with women. I think it's also important to recognize, I know you mentioned church groups and others, but I think it's not only the woman, even though she's the one who's carrying the child. Sometimes we hear it takes a village, but it's important for the woman's partner, wider family, grandparents to also be involved in providing support, and that means also having nutrition knowledge and the education that we've touched on as well.
I was just gonna say that to like start, like we could start in this room, we could start like having a conversation and being like, hey, we need a weekly group, like how can we make this work, or talking to your neighbor who's pregnant and be like, hey, what support do you need? What's your plan for after baby's born? Like just making these personal connections with each other so that everybody feels supported. And it's amazing what happens when you have a conversation and be like, oh, well, I know this person, and then like stuff grows. So like just from this room we can have this growth, and then it like trickles up and makes more and more change. So like I have a walking group. It's a mom we call it Mama Walk and Talk. So every Tuesday morning we go walking. It's the same thing. It's just bringing people together for that connection. And like I think I mentioned this earlier, the Ojai Birth Collective. So that's like all the providers coming together and being like, okay, what does our community need? We need a breastfeeding group. We need a postpartum pantry where when you need your breast pump and Amazon can deliver tomorrow, but you need it tonight. Like you reach out and you find it because somebody in that community has a breast pump and would be happy for you to use it. So that's my idea is like start with the connections, have conversations, get off the phone, talk to people.
You're my 102 class with a great example of graduate organizing. Do you mind if I put it one more time? I know we were talking before, right? So we were like chatting, and you were talking about like how you found public health and all of that. Does anyone want to share? Because I think a lot of students are trying to find their path, like how they discovered what they wanted to do and kind of their career path.
I can go. I mean, since I work in public health, so I went to grad school in Florida to get my MPH, and while I was getting my MPH, some of my friends were already working at the health department, and they had a few events where they needed extra help for just doing like tabling and stuff like that. So I started doing those activities. I started learning more about the different aspects of public health, so things such as like bioterrorism, HAI, so hospital associated infections, different things like that. I forgot the acronym. And so just kind of seeking out new experiences and opportunities. I wasn't getting paid initially for that, so just kind of exposing myself to different aspects of public health. There's the policy side, there's the epi side, there's the biostat side, there's the health promotion side. access to public health. So whatever you're interested in, I think just kind of going down that route and just leveraging like any other experiences you have.
I had a medical social worker. When I was 15, I was hospitalized and I had a pediatric medical social worker. And I've always had a passion for mental health. I've known I wanted to get my bachelor's in psychology since I was 13 years old. And she was the only individual in the hospital that asked me how I was actually processing things. I was a kid, so people talked to my parents mainly, but I was a teenager. I knew everything that was going on. And I knew I wanted to do that for other people. I didn't know exactly what unit I wanted to be in or anything like that. But yeah, I just wanted to be the person that checked on the patient, not physically, but mentally, emotionally, and how you were processing it and what you were going to do after. And then when I started my job, they were looking for a second maternal child health social worker. I have a partner in the NICU and postpartum and L&D. They were looking for someone to work with her, and I was more than happy to volunteer because I could be that person that had that longevity of care in the NICU, but I also had those 1 or 2 visits in postpartum and those 1 or 2 visits in labor and delivery. So yeah, I like the fact that it was an opportunity to learn, and it was a great way to pay it forward.
You'll have to share since it was on the list, but you're welcome to if you want to.
Yeah, I can say for me, I think a pivotal experience was I majored in environmental science, and then after I graduated, I joined the Peace Corps, where you volunteer to work usually in a low-income country. So I was assigned to work in Ghana, and I was trained for a few months in Ghana, and then lived in a very remote village for 2 years. And I was sort of assigned to do environmental work with that community, but living there as the only person from the U.S., I was learning about what was happening in the community, what a lot of the needs were, what challenges people were facing, what joys they had, or what, how resilient people were there. And I was realizing how, public health, or a lot of children, women's health, were sort of outside of their control, or how many health needs there were, and how I think maybe connected to the environment was nutrition. A lot of foods, nutritious foods especially, just weren't available, and there were different seasons, a rainy season and a dry season, and that really, really drove what people, including myself when I was living there, were able to eat. We didn't have electricity, I didn't have a refrigerator to store food, people were collecting wood to cook the food, which is hard also during the rainy season. Anyways, I think all of my experiences, again, maybe just getting out there and exposing yourself to new things, showed me how important it is to, have health, or how important nutrition is for optimal health, and how challenging it can be, but also how the environment is a place where the environment and health can connect in terms of nutrition.
I majored in environmental biology and actually was going to be a scientist. Maybe still will, because you can have lots of professions in your life. Actually ended up working in outdoor education for 10 years, so doing backpacking, rock climbing, mountaineering courses. Really loved that work. Felt like I was working with people at a transformational place in their lives. Also very responsible for people. And then I wanted to have a family, and I was like, well, I can't be pregnant and backpacking and gone from the kids, and so I was like thinking of something new. And so growing up, all of my siblings were born at home. I have 4 younger siblings, and they were all born at home, so home birth was actually a part of my upbringing. So I'd always been interested in healthcare, and so I was like, oh, maybe I'll become a doctor. And then I remembered about midwifery care, and I just feel kind of lucky that I fell into it, and it was a real good fit for me, because I feel like they seem so different, like backpacking and midwifery care, but but it's like being with people, being with families when they're going through a huge transition, and also like it's being responsible for other people's lives. Like that's a big deal. Not everybody can handle that. And I'd already done that, so that part wasn't as hard for me. So I find it incredibly
question before I open it up for audience questions. Is there anything I didn't ask you that you want to share or like re-emphasize or anything before I ask our last question? You don't have to. I asked a lot of questions. Feel good? Okay. Final question. As leaders in the local community, what advice do you have for the students in the audience who will soon be trying to secure employment?
Apply to a lot of jobs and be open to different opportunities. When I was applying for jobs, I applied at several different types of facilities. I knew I wanted to become healthcare, and I did my research and I listened very thoroughly to every single thing every single interviewer said. But also don't be afraid to stand up for what you want in your career. Whether that is education, whether that is salary, things like that. I know one of my biggest things was the next step up in being a social worker is getting your license in clinical social work, and I was not going to accept a job that didn't provide that supervision and education. So that was one of my first questions in my interviews. So yeah, just know that there's a lot of opportunities. Don't narrow yourself down, and don't be afraid to stand up for yourself.
I would say, not getting too complacent. For example, you may be working a job where you don't plan on being there forever, but, still take advantage of the different experiences that you're getting in that job, because guess what, when you do land that interview at the hospital or the health department, they're gonna ask you questions, and to provide examples about when you collaborated with others, when you took initiative, things like that. So leveraging the experiences you have, doesn't matter what kind of job it is, kind of put yourself out there and try to think forward and get as many skills as you can kind of in your tool belt so you can talk about that when you do land those interviews for the job that you do want.
I think also networking a bit, or not being afraid. Now we have LinkedIn and so many, we've talked about social media and technologies to interact with people, which has pros and cons. But I think also reaching out to people on LinkedIn or wherever it may be to just have a conversation and learn about their career paths, even benefits and challenges of the job. Set goals for yourself, or think about what you want first out of a job, maybe before applying, and letting what jobs you see influence that, I think is important. I know for me, even how I keep thinking whatever job I'm in, I'll be in, maybe it's just my personality, but I'll be in for the rest of my life or for such a long period. But I think unexpected things keep coming up, like you mentioned having kids. My job was largely involving a lot of travel and working in, specifically sub-Saharan Africa, that I was drawn to for a variety of reasons and had a lot of experience there. But then COVID hit, which was unexpected. And then I had 2 young children. I also didn't want to travel as much. Now, other things that are happening in the world are also influencing public health, my nutrition, career. So still, I think there are always different swerves that come up. So for me, I've been trying to tell myself also that, what I'm doing now or what I'll start next may not be for the rest of my life or even for the next year, and having some flexibility around that has been helpful, at least for me, to not get stuck too much and being open to pivoting and thinking about how to pivot as well.
I'll just put in a little plug for thinking outside of the box and maybe starting your own business, right? So you don't necessarily need to look for employment with somebody else, but if you're the type, so I guess even before that, is just reflecting on your strengths, your desires, what it is that you're wanting, even before you go looking for something, right? So that you could, and once you're really solid in that, then you can make sure that it's a match if you do find a job somewhere else. But if you are the type that likes to do everything, likes to be in control of everything, really has a lot of initiative, like there's a lot of benefits to running your own business. And I feel like there's more and more of that happening. It goes back to that connection with other people in your community, providing services to your local community, and it's really amazing. And I have found that it works really well with my family, right? So when you run your own business, like I can work when my kids are in school. I can work less when they're little. Now they're all in school full time. I can work more. I can take time off in the summertime. I can, you know, so if you can kind of really, it works well for me with my family. So, and I'm not saying that you have to be a midwife. There are a lot of small business owners out there in the health profession. So it's just another option.
I hope all your husbands are proud of you all right, it's time for you all to ask questions. You can go ahead and just raise your hand if you have a question. Ask the whole panel, ask someone specifically. Yeah, we'll go all the way in the back first.
Me?
Yes.
Do you have any advice for mitigating the harmful effects of elevated inflammation during pregnancy? Either nutritional or exercise or different routes.
I mean, I think from a nutrition, well, maybe in general, I think it would be helpful to know what the cause of the inflammation is. I mean, my mind went specifically to populations where infections are high, whether it be parasitic infections or others which contribute to inflammation. And then in turn that can have negative effects on even nutrition outcomes or absorption of nutrients. But I think getting at the cause of it and knowing what the cause is would be important. And then, I mean, in terms of nutrition, we can think about what foods or nutrients might be beneficial to reduce the inflammation if nutrition is a way to help it. But again, I think preventing the inflammation rather than treating it with food or other supplements might be useful. I don't know if you or others are familiar with the main causes of inflammation, but I think thinking about what the causes are first would be important.
Sure. Thank you.
Speaking of postpartum care, are stillbirth mothers given the same resources and even more so, such as a cuddle cot, but is there a lack of that support in Ventura County, as well as with your education to mothers after postpartum? Does that include safe sleep and SIDS prevention?
I can answer that. So our public health nurses, we do provide education to families on safe sleep and also just overall just safe environment at home for the babies. We do home visits where we'll kind of walk around and make recommendations. And we do have a program where we do mail out like little grievance kits to families that does include stillborn babies. And we also offer our public health nursing resources as well. So we can go over to their home, we can, you know, talk to them over the phone or do it virtually, but we do offer those resources to those families.
So part of my role is meeting with all moms that have lost a child, whether that's, you know, regardless of how many weeks along. And so, yeah, we do offer a lot of those postpartum depression resources, even more so emphasize those possibilities, but also keeping in mind what they went through, right? So a lot of postpartum support groups, people bring their babies. So you don't want those moms that don't have that baby to then go to those support groups. So finding those loss, grief specific support groups is very important, which we do have those resources for. But yeah, we offer a lot of grievances. We make memory boxes in the hospital with baby's footprint, handprint, all that kind of stuff for those moms to take home. And if they're not ready to take those home immediately, I store them in my desk personally. I give them a cell number that I have at the hospital, and they can call me whenever they're ready for it, whether that means picking it up at the hospital, mailing it out, whatever is easiest for them. And we just sit with them as much as we can, and whatever that may mean, whether that's physically sitting with them and talking to them about their grief, or just mentally them knowing that we are there and we are able to be there for them. And that goes beyond them being in the hospital. I do have a work, like I said, I have a work cell phone, so I will keep in touch with those moms as long as they need grief. Or physically, how do I remember this baby? What can I get from this experience? And yeah, I'm going from there.
What other questions?
Because of COVID, what changes were implemented in your field of work and now you need a standard for that was in
I can speak on specifically in the NICU. Only 2 visitors are allowed per baby the entire time baby's in the NICU, and those visitors cannot change. So we call them our banded people, and they have a band with baby's name on it. And those are the only 2 people allowed in the NICU the entire time. So grandparents will go months without meeting their grandchild, siblings, all that kind of stuff. as it's safe and then less exposure to people.
Other questions?
Yeah, I have a follow-up to that. So what was the standard before COVID?
You were allowed to rotate visitors. It was 2 at a time, and siblings over a certain age were allowed. I'm not sure, I forget what that age was. But yes, with siblings over a certain age were allowed in with a parent, of course, and you could rotate. So there was only 2 allowed at the bedside at a time, but it could have been different people throughout the stay.
So 1 or 2 more questions.
So I actually had multiple, I just had one for each one, but I'll try to do it briefly.
We'll see how fast they answer.
So Ms. McCracken, what policies or insurance barriers making it primary care less accessible to women who want it, and how many barriers will be removed?
It really has to do with the expense, and I'm actually on the California Association of Licensed Midwives, and we're working hard with legislation to try and increase coverage, increase Medicare coverage payment, so that it becomes financially a financial possibility for midwives to provide that care. Like right now, it's just not a financially responsible decision as a small business owner to provide that care. So I think that's the biggest, is like if we can get reimbursed for our services, which are actually less expensive than hospital services, it would be a win-win for everybody.
Okay.
Do you have any instances when, like, if women go in for like an abortion, and if so, like, what kind of resources do you have for them?
I don't provide abortion
Um,
services.
So we also will provide postpartum depression education to those moms as well, because they're still gonna have those hormone changes and things like that. And regardless of, like, obviously that's their decision, but there is still a mental battle that goes with that, right? Making that decision is very, very difficult. So, we'll talk to them about the mental health piece of it and offer those support groups and, just having that conversation with them of what their body may go through, because, you know, they still need to take care of themselves even more so.
In the hospital?
I only leave the hospital.
And so how long is that care? So like when they get discharged, do they come back and see you? Do you have an office? You're seeing them in their hospital room? I'm just trying to imagine.
Yeah, so I see, in postpartum, I see moms in their hospital room.
Okay.
And that care is only when they're in the hospital, and then I set them up with care outside. So I refer to public health several times every month. I set them up with enhanced case management, which is through CMH specifically, as well as the New Care Resource Center, things like that. So I can make sure that they're connected to providers outside of the hospital, but I'm not that provider, if that makes sense.
And when you meet with them in their hospital room, are they usually by themselves? Is there somebody else there?
Depends whatever they're comfortable with. And then I always make sure I ask if they're comfortable speaking with their spouse in the room or with a family member, mom, whoever it may be. Most of the time they say yes, and a lot of the time that conversation happens with both parents because the other parent is going to be helping with recovery and things like that. And it's important that that postpartum depression education is with everybody that will be involved. And then with the NICU, I meet with them at the NICU bedside, and that will last however long that child's in the NICU. I've had kids there for 3 days, I've had kids there for 4.5 months. So it just depends. But again, we always set up with resources outside of the hospital after that discharge.
Before we wrap up, I'm sure they'll hang out for a minute or 2 after if someone has a question, if not, just do a run. But just a couple reminders, please find the QR code to sign in. Also, just a second reminder, Cope Scholars is outside if you want to chat with them. There's also some other cool free swag set up by the door. Monisha brought.